Hello, everybody. This is Medicare changes for 2026. And of course, I'm Faye, and I sell Medicare plans. I've been in this business for 23 years. And of course, that allows me to know a little bit, just a little bit, about Medicare. And I am, so that you know, a card-toting Medicare beneficiary. So let's get started. First of all, right off the bat, I need to tell you that I do not represent all plans in your area. For information about all plans, please contact Medicare.gov, 1-800-Medicare, or call your local SHIP office to get additional information on all plans. Let's start with what is Medicare. Most of you know what Medicare is, but just so that we are clear, Medicare is a federal health insurance program. It's for people who are age 65 or older, although younger individuals with certain disabilities who have received full Social Security disability may be eligible for Medicare after collecting Social Security disability payments for 24 months. For certain individuals who have specific diseases like end-stage renal disease or Lou Gehrig's disease, they can receive Medicare immediately and do not have to wait for age 65. There's a few months waiting period, but it becomes much quicker for people who have end-stage renal disease or people who have Lou Gehrig's disease. So there are really two parts to original Medicare. Part A, and if you are familiar with the Medicare card, which most of us call the red, white, and blue card, Part A is hospital and Part B is medical. So Part A helps you to cover expenses for inpatient hospitalization, skilled nursing, home health care, takes care of hospice expenses, and Part B would help to pay for outside medical providers' services. So those services might be any medical services that are medically necessary, but are also covered by Medicare and would include things like lab services, lab tests, x-rays, surgeries, anesthesia, all of the services that are billed outside of the hospital that are covered by Medicare would fall under Part B. Now, if you carefully were listening, you heard me say that Part A and Part B helps to pay. These are not benefits that will pay 100% of your medical expenses. And some people have the idea that, well, as soon as I get Medicare, I'll be all set because I'll have health insurance. Yes, once you become 65 or once you have worked for 40 quarters, you get Part A and you're not paying anything for that. You get Part B and there is a premium and you may or may not need to pay that Part B premium. However, Medicare, original Medicare, Part A and Part B does not cover all of your medical costs in full. So Medicare actually gives you two options. If you decide that you want to use original Medicare, which is where you can use any provider that accepts original Medicare, there is no network requirement. The provider just needs to accept and be able to build the original Medicare system. So if you use that system and now knowing that Part A and Part B will not cover 100% of your expenses, you may want to add to that what's called a Medicare supplement, or sometimes it's known as a Medigap plan. What the Medigap plan does is it picks up covered Medicare expenses that Medicare approves but doesn't pay for. So that's the gap that's going to cover those things that Medicare approved but helps you to pay for but doesn't pay in full. There's still some annual deductibles for the Part B that you would have to consider within most Medicare supplement plans. Medicare supplement plans are offered by individual insurance companies. So you can't purchase the Medicare supplement from Medicare, not from the government. The plan is purchased through an insurance company. No matter where you are in the United States, the Medicare supplement or Medigap plan that you purchase, the benefits for that particular plan are going to be the same. So the benefits are the same no matter where you're located. However, the rates or the premiums for those supplemental plans will be different based on the company, based on the area, based on your age, based on your gender, and based on if you're a tobacco user or not. To have a full comprehensive medical plan, you would also need to add to original Medicare, the Medicare supplement, and a standalone prescription drug plan. So that's one option that you can use. If you decide that that's the way that you want to use your Medicare benefits, that's fine. There's absolutely nothing wrong with that choice. However, remember the Medicare supplement and the standalone prescription drug plans are two plans that you will purchase from an insurance company. And those rates or those premiums, you will bear the monthly premium for those plans. The other option is a Part C program, which is also known as Medicare Advantage. The Medicare Advantage plans combines Medicare Part A benefits, Medicare Part B benefits, and most of them will include the prescription drug benefit. In many, many areas, the Medicare Advantage plan has no premium. These are the plans that look most likely like the plans that you have when you're in an employer group plan. The Medicare Advantage plan could be an HMO or a PPO. HMO meaning Health Maintenance Organization, where you have a network and you must stay within the network unless it is an emergency or unless you have prior authorization from the plan to go outside of the network. The PPO allows you to choose at the time of service if you will use providers in network or out of network. We'll talk a little bit more about the changes that are coming about in the PPO plans for 2026 as we get further into what are the actual changes for 2026. But first, I wanted you to understand clearly what your Medicare options are. So if you have questions, let me just go back over this one more time. You have an option of using Original Medicare, where you can purchase a Medicare supplement to pick up the benefits that Original Medicare approves but doesn't pay. And you also would purchase a prescription drug plan. So one option is you're going to have 3 cards. It's your choice. And if you can pay the premiums monthly for Medicare supplement and the prescription drug plan, and that's the way you choose to have your benefits, that's great. The other option is to choose a Medicare Advantage plan that is a plan that is approved by Medicare, that's offered by a private insurance company, it must cover those benefits of Part A and Part B, and most often will include the Part D and may not have a premium at all. However, the Part C Medicare Advantage plans will have or may have copays or coinsurance for certain benefits when you use those services. So in the first option, you're paying a monthly premium, whether you have any medical services that month or not. And in the second option, you're paying copays or coinsurance, out-of-pocket costs for certain services when and if you use those services. And let me just add that the Medicare Advantage plan does have an annual maximum that you can spend for covered medical expenses. So this is all about why should you have an annual Medicare review? So changes in coverage, changes in costs, changes in networks may affect you. And there are changes that neither you nor I have control over. There are changes that are brought about by the Center for Medicare and Medicaid Services, which is CMS. There are changes that are brought about by the people who actually run the insurance companies, because every insurance company wants to fit their plans into what is approved by Medicare, but also they are looking to spread the benefits out in the best way that they can and help their customers to utilize the benefits that are in the plan. Every one of you, if you are currently a Medicare beneficiary and you currently have a Medicare Advantage plan, you're going to receive what's called an annual notice of change. For short, we call it ANOC. What that annual notice of change is, and I read something earlier this morning where someone called their insurance professional and asked, what are the changes? And the insurance professional said, did you get your ANOC? And she said, yes, I did. And the conversation went on, did you look through it? No, I threw it away because it was 50 pages. Well, that's the page. Those are the pages that tell you what your changes are for 2026. Those are the pages that, even though some of it is repetitive, you will know what the changes are. That's why you're receiving it. Every insurance company is required, if it's a Medicare Advantage plan, to send to every Medicare beneficiary at the address that they have on file or through electronic means an annual notice of change to be received by September 30th. So if you have your annual notice of change, take a moment and look at it. You can see what the changes are. This is where you start to really make the decision, is this a change that I can live with next year? Or is this a change that forces me to actually look to see what else is available for me? So in that annual notice of change, as you're looking at those things that are going to change, you may also find options where that will save you money. If you can save out-of-pocket costs by using a plan that has perhaps more over-the-counter benefit, or that has other benefits that you know that you can utilize, like transportation, or there is a plan that may be available to you where money is transacted in a different way so that it saves money out of your pocket, then those are options you should consider. Those are things that you need to look at. So how can I help you? Well, first of all, let me just tell you that I cannot help you unless you give me permission to do so. I cannot help you unless you say, Faye, I need an appointment, or you call me to set an appointment. And as we go through this, I'm going to give you a link where you can set an appointment with me so that we can either talk on the phone or you can come into the office and we can talk one-on-one. So now let's talk about what you have been waiting for. Let's talk about some of the changes for 2026. Well, first of all, last year, you remember, or this year, last year, when we were talking about the benefits for 2025, we were so very happy to let everybody know that you have a cap on the amount of out-of-pocket costs that you spend for covered prescription drugs. So for 2025, that's $2,000. Well, 2026, it's going up by $100. So the most that you would spend for covered medical prescription drugs would be $2,100. Now, if your drug is not on the formulary, that means it's not covered. So that doesn't count towards the $2,100. If you use a discount card to get your prescription, so you're paying out of pocket using a discount, that doesn't count towards the $2,100. So that's one change that you can look for. There's a change with the way people who are currently receiving what's called quote unquote flex cards or food cards. That program, due to nothing to do with the insurance company, nothing to do with me, nothing personally against you, but the Center for Medicare and Medicaid Services, CMS, who controls all of this, has taken away what we call the value-based incentive plan. The value-based benefits that where the insurance companies were able to allow larger amounts for food and utilities is no longer, it doesn't exist anymore. I don't know how else to break it to you, but it just does not exist. Now, there is a different program. It's SSCIB or SSICB. I can never get those letters correct, but there is a different program. And if you have certain chronic illnesses, you may still qualify for some help with those utilities and food cards. So now for most people who do not have full Medicaid, you will see a difference in your plan and you will need to look at what plans are out there that may have a chronic plan that fits a chronic diagnosis that you have that can be verified by your doctor, your primary care doctor, so that you can still get some of those benefits. But bottom line, the VBID benefit no longer exists. Part B premium, for those of you who actually pay the Part B premium, is going from $185 per month, the basic standard Part B premium from $185 per month to $206.50 per month. Now, there's also rumors and chatter about a Social Security cost of living adjustment that would increase the amount of Social Security that you're receiving. So that $206, that difference between the $185 and the $206 may, I'm not sure, I don't know, may be washed away by the increase in cost of living adjustment that everyone receives. And that final number has not been given yet. Formulary changes. Here's something that you really seriously need to consider, and it's why we ask when we're going to sit down to review benefits for 2026, what prescriptions are you taking? There are tools that an insurance professional has where we can put in those prescriptions and see under all of the plans that are available to you how those prescriptions will be covered. So these are the formulary changes that will be expected. First of all, tier changes. Prescriptions that may have been tier 2, standard generics, this year may be tier 3, preferred brands next year. Prescriptions that are tier 3, preferred brands, may be tier 4, standard brands next year. And what that means for you is, and the reason for the change in the tier is there would be greater cost share, more cost share from you than if the prescription stayed on the level where it is. And that's not the only formulary change. The other formulary changes may be that certain drugs that have been expensive, that have not received any of the discounting that has been done through Medicare negotiations with the pharmacies or pharmaceutical companies, rather, those prescriptions may not be on the formulary at all. It may have been on the formulary this year, but it doesn't mean that it's on the formulary next year. So that's another consideration that you need to look at. Network changes. Providers are still in the business of being in business. And we often say doctors are taught how to be doctors. They're taught how to diagnose illnesses. They know what the symptoms are. They know what the treatments are. They know where to find all of that, but they are not given the business acumen to actually run the business. But in order for them to stay in business and continue to doctor, they have to run a business. So someone runs those businesses for them. And their accountant may have said to them, in order for you to be profitable in 2026, you need to limit the type of plans that you're taking. You need to limit the number of insurance plans that you are accepting. These are the plans that you should look at. So your doctor may not be in network, and it could be the doctor's decision. On the other hand, the insurance company has certain requirements for reporting because they are accountable to Medicare, and the doctor may not be in network because the insurance company has decided we're not going to be able to extend a contract to you. There's also the situation where the two cannot agree. The insurance company says this is what your contract will look like for 2026, and the provider's office, the hospital, the provider organization says, no, we're not going to accept that. We know what we do and we do it well, so we can't accept it. So network changes can affect you. And that might be a minor thing. You can easily find another provider, but in some areas, it's not that easy. So but that is something, and it is a change that you need to look for. Plan exits. I mentioned earlier about PPO plans. Because the PPO, the preferred provider organization, is the plan where the consumer actually at the time of service can decide if they want to be in network or out of network, knowing that if they're out of network, they have more out-of-pocket costs. But it's still their decision. They may decide that, okay, I want to use this provider. I'm going to go out network, and I don't mind paying the additional out-of-pocket cost. Well, because that takes away some of the managed care aspects of a Medicare Advantage plan, the insurance companies suffer greatly in those instances. As we have become more and more educated consumers, and people were using the preferred provider organizations more often so that they can make choices on their own, the plans have suffered because it's not as easy for the insurance company to know what their total cost is going to be when you're out of network. So some plans will be exiting, and most of the plans that are exiting, no matter what area you're in some areas it's more than others, are those PPO plans. It may or may not be the PPO plan that you are going to lose. It may be an HMO plan, but in most cases, the PPO plans are the ones that we're seeing that are exiting most. And there are certain insurance companies in particular areas where they've not been able to negotiate great contracts or meet the CMS requirements. They are not offering Medicare Advantage plans at all. So those are the things that we're facing for 2026. We've talked about the benefit changes to the flex card. So if any of these changes, anything that I have mentioned may affect you, you don't know right now because you don't know and I don't know specifically what the benefits will be unless you have already received your ANOC and you know what your current plan will look like, but you don't know what else is out there. But if you think about it, and if any of the things that I've mentioned may affect you, any of these changes, then it is important that you let me talk to you. So these were the things that we covered. The annual maximum 2,100 for prescription drug, covered prescription drug, Part B premium 206.50, formulary changes, network changes, plan exits, and then the benefit changes to the flex card. Those are the things that are most important. So if you feel that any of these things are going to affect you, and I would not take any chances that it's not, this is the link that you should copy. I'll put it in the chat. I'll leave it there for a minute for you to kind of write it down, make sure that you know what it is, because that's where you're going to go to set your appointment. Now, because we're doing this today and I have set aside time on my calendar immediately after this to actually set your appointment and do about a 10-minute call with you to give you what is needed in order for us to do that Medicare annual review. So go ahead, set that appointment. If you don't mind, the Medicare annual review will go in depth after October 1st. But this is the link that you're going to use to set that appointment. So if you want to get answers, I'm here to give you those answers. But I have to remind you again that the Center for Medicare and Medicaid Services require that you give me permission to talk to you about those benefits. Your next step, give me the permission to contact you, set the day and time best for the call, put my number in your phone. And I thank you. Now I'm going to go back to our regular Zoom meeting and ask if there are any questions whatsoever. And I'm going to put in chat the link in the event that you want to go ahead and set that 15-minute, 10 to 15-minute appointment with me today. Any questions? You've been a very attentive audience. Thank you so very much for attending. My name is Faye, and you can reach me using the link that's in the chat to set your 15-minute call, or call me at 407-340-6282. Thank you once again for joining us this morning.